I'm going to try to get through what I want to say really quickly, because there's just not enough time to get into all the things that I have experienced since my de novo metastatic breast cancer diagnosis in July of 2020. Obviously, as an advocate, I've seen how cost of care and all the things that happen outside of treatment itself are a problem for everybody, or a lot of people within the community itself. So it's not just about me, and I want to talk about that briefly too. For me, I've had a lot of periods in my life where I have not had health insurance, even when I had full-time jobs that were contractual, non-benefited jobs. And I think I never realized some of the ramifications of those kinds of things. And also, being a social worker in the nonprofit field, I never had a retirement plan. I never had any of that. So I came into the cancer situation already having financial difficulties. So I had a head start to the people who have become part of this club because of the cancer itself. I was on the ACA coverage when I was actually diagnosed, and I actually was putting off going for my mammogram, even though I knew something was wrong, because I didn't have transportation, and I had just come off of a year-long recovery from an injury that I had, multiple injuries, in fact, where I couldn't even get out of my house. So when I actually talked with my primary care physician and showed her what my breast looked like, she was very concerned, and I told her I needed to save up money to take a Lyft ride to get to where I needed to go for my mammogram. Thankfully, she picked up on this, that this is what was keeping me from doing that. And the next thing I knew, I did have a social worker call me about getting me there, and they would cover my transportation. Well, the problem is that this was, of course, during the pandemic, and all of the resources that supposedly are available to us, which I have never really found any of those to be true, were not available because of the pandemic. So my provider, which was also my insurer, took care of the transportation. But that was not without me needing to tell them every time I called for a ride to appointments that I had to give them verification that I had contacted Road to Recovery and all these other groups that supposedly provide transportation to prove to them that I'm looking for something outside of them as a resource. And I didn't have that. So I don't have anybody to lean on to take me to appointments, any of that kind of stuff. Then I was forced to move. My landlord said they wanted their in-law suite back for family. And so I was a week away from chemo. It was the day before I found out that I'm actually stage 4, and I shouldn't have started on chemo, by the way. And so now I also needed to deal with a move during a pandemic with no money, no help. I did end up getting that done, thankfully, because of the help of some people that I haven't talked to in a really long time that rallied around me and got me to my next place, which is where I am today. So then what ended up happening is I had to change my address on my health insurance with the ACA. And the next thing I know, everything started to snowball. And they said, because I moved only 4.5 miles away, my insurance was going to go up by $75 a month. And I knew that I couldn't afford that, but I also couldn't afford not to have health insurance after being diagnosed with MBC. So they kept asking me for more information. It was very, very upsetting, of course. And then the next thing I know, maybe about a month later, I got a surprise phone call from the Maryland Health Exchange that said that I was eligible for Medicaid. So I have been on Medicaid, ACA, and having no insurance. And Medicaid's really different than ACA coverage, even if they tell you that that they're the same. They're not. There are things that I can't access because of Medicaid, but I do get my transportation, which is important. So now, as you know, Medicaid's coming to an end for a lot of us, and the pandemic was, in some weird way, a gift to me, both with unemployment insurance that I wouldn't have ordinarily gotten, and then also with qualifying for Medicaid. And now I have another housing crisis that's just about to start, given that my current landlord says she needs the place back, she's going to do work to it, things like that. And one of my challenges is that I've been trying to find help for the stuff outside treatment, right? So I end up getting all kinds of lists from social workers and so forth, and none of these things fit me. So there's a lot of time toxicity involved in all this stuff too. And I find in general, I end up spending three to five contacts, whether that's emails or phone calls, to get basic needs met and all these kinds of things. And these resource lists, nothing fits me. I mean, I'll give you an example. I just applied for some rental assistance that was supposedly approved on March 16th. It's only for $500, but I had to let my landlord know that supposedly she was going to be getting a check. Well, she never got the check. And then I followed up on March 31st with this group that issues this financial assistance. Never heard back from them. Contacted or sent an email to my social worker on April 5th. I haven't heard from anybody about this. So I don't even know if that's ever going to come through. But I have to move at the end of May, and I don't have the means to do that. So we have a lot of problems with people not being able to get what their needs are met. And that's not just about treatment. As a matter of fact, I have found from other people that I've come across on different forums and things like that, especially related to Medicare, that people need help with their medication costs. That's not my situation today, but it very well will be later. I've been on patient assistance programs when I was first diagnosed and so forth. And it looks like that's going to be part of the picture for me going forward. As for SSDI, I can't live on what that would pay me right now. And I've been looking for a full-time job as a national executive director or CEO of a nonprofit for 10 years now. And then, of course, chemo didn't help. It aged me overnight. And I know it's hard to imagine, but I actually used to be even better looking than this. So point is that ageism exists. It messed up my teeth. It's been hard to interview. And finally, I've given up, but not for a bad reason. I'm actually starting a nonprofit to try to deal with some of this lack of resources, especially for people who live alone and can't count on other people to help them with the rent and help them with, some of the other things that cost money that when you live by yourself is really just up to you. You can't lean on someone else. So you'll be hearing more about that as we go. But, my attitude on the cost of care is that the best way for us to eliminate the burdens that cancer brings is for us to cure it. And with that, thank you for having me today.
Thank you so much, Mary, for kicking off this really important conversation on the financial impacts of metastatic breast cancer. Next, I want to welcome Pam, who is the Senior Vice President for American Cancer Society's Cancer Action Network, to go more in depth on the issues that Mary touched on in her introduction. So welcome, Pam.
Thank you so much. Really appreciate the opportunity to be with you all today, and want to say to Mary, thank you for sharing your story. I think it takes a lot of courage to share your story, and I'm really struck by the fact that you're representing a lot of women who are in very similar situations, and that is truly unfortunate. So I'm really excited to share with you today a little bit of the work that my organization, the American Cancer Society Cancer Action Network, or ACSCAN for short, if you can call that short, has done around the costs of cancer. And I want to disclaim right from the beginning that every single patient has a unique circumstance, but I think it's important that we all have a sense of, what the costs of cancer really are, and what this means for women living with metastatic breast cancer. Okay, so let's start by thinking a little bit about something that I think you all already know. Cancer is really expensive. By 2030, we estimate that this will cost $246 billion, and that's billion dollars in the United States around cancer healthcare costs. Keeping in mind that many patients do not just have breast cancer. Cancer patients have on average 5 comorbidities. So it is unlikely that your only medical expense is breast cancer. When we think about it, not just from a system perspective, which is this $246 billion number, when we look at 2018 data, which is the last year that this data was available, we actually found that $5.6 billion was spent by patients on out-of-pocket costs. This is an enormous expense. And as I tell people, very few people have budgeted to experience cancer in their lifetime, let alone healthcare. This is a very difficult challenge. 51% of the patients that we've surveyed report that they have gone into medical debt as a result of their cancer treatment. And over 70% of patients worry about their ability to afford their care. And that's really, really striking and truly unfortunate. I think we all know that battling cancer is very difficult. Battling cancer while you're thinking about how to pay for your treatment is even more difficult. So let's talk a little bit about metastatic disease. So we know that cases of metastatic breast cancer are increasing. And in fact, we're going to see a growth over 15 years between 2015 and 2030 of 54%. This is challenging. This means many, many more people will be facing metastatic breast cancer. And in fact, the costs will increase. So it's estimated that metastatic breast cancer will cost our country $152 billion in 2030. This means that this is an urgent problem for our healthcare system that we all need to work together to solve. But I think for many of you, you might have a little bit of a different story. And I want to talk a little bit about that because there is, in fact, data about the women who have metastatic breast cancer. So for women that are 18 to 44 years of age, metastatic breast cancer is actually a very large expense. In fact, it is more expensive for those women to battle their cancer than it is for older women. So you see here in this data that for these younger women from 18 to 44, the monthly cost of treating metastatic breast cancer is over $4,400 compared to the monthly cost of $2,400 for a woman of the same age who has stage 1 breast cancer. This is a really unique thing and has a lot to do with insurance benefit design. It is why many of you are involved in Living Beyond Breast Cancer, because there's a unique burden for women of working age who are battling this disease. We also want to talk a little bit, and Mary mentioned this, I thought, quite well in sharing her story, that it's not just about medical costs when we deal with metastatic disease. We are talking about lost productivity. These are, time away from work or potentially what you're able to do in the home. So they've actually valued out the per woman cost of lost productivity. And basically what we see here is among older women who might be potentially closer to retirement age, we're talking about nearly $680 per day. And for younger women of working age, this cost can be over $5,000. I think this is a really important story when we talk about women with metastatic disease. We really want to really focus on the fact that it's not just around medical costs, but it is the lost work and home productivity cost that really contributes a large amount to what it is to living with metastatic disease. When you think about these numbers for a moment and compare them against some of the other data that I've shared with you, you can really see the staggering cost that metastatic breast cancer represents in our overall healthcare cost. And I think that there's a lot that we need to talk about together about how we can resolve these costs. I think while it might be helpful for some of you to hear that you are not alone and that these costs are in fact as significant as you think they are, perhaps I think the biggest challenge here is really thinking about what this means to you and what you can do to resolve these costs. Okay, so when we think about this, I'm going to talk a little bit about some of the things that you can do on around affording your cancer care. Now, I can say right off the bat that I know many people are struggling with costs outside of their cancer treatment. And that is, in fact, a really, really large challenge. I think Mary's story about receiving housing assistance is quite typical of patients that I deal with. It's a network and a series of phone calls. It's applications to fill out. And then there's a lot of follow-up that begins with that. I want to start first and foremost, though, about talking about how to better manage the costs of your cancer care. Oftentimes, I tell patients if we can really work to resolve some of these issues, potentially households will have a little bit extra money to potentially afford the rest of their life if you weren't spending so much on your cancer care. This is very, very challenging. So first and foremost, I think the number one thing we need to do when we're talking about metastatic disease is to learn a lot more about your insurance. In fact, many patients, whether they're employed or in Social Security, never really take an in-depth look about what their insurance options are. I know this is not exactly the most exciting way for people to spend their time. And in fact, there are insurance navigators in every state that can help you evaluate your options through your state Department of Health. You really want to evaluate what your insurance coverage is. You want to understand what your deductibles are. You want to understand, obviously, who's in network. Are your doctors in your network? Are your labs in your network? How does this fit with your current treatment plan? In fact, the American Cancer Society offers a health insurance assistance service. The 800 number is listed here on the screen. These are trained professionals that can help you walk through your insurance options, help you make insurance appeals, and generally understand your insurance. When we think about people with cancer, very few cancer patients in the middle of their journey decide to change health insurance plans. Oftentimes, a change in health insurance can make a big difference in your ability to afford your care. This is particularly important since a lot of times when it comes to drug coverage, insurance companies may change the drugs that are on their formulary from one year to the next, which may, in fact, change the amount of money that you're paying for your care. I don't need to tell women with metastatic disease how many times you're in with a doctor, how much money you're spending on scans, and things like this. If you think about it over the course of your disease, this is why the costs that I indicated on the prior slides are so high. You know very well how often you are going to the doctor's office. So really thinking very discreetly about what your insurance is costing you, and is there an opportunity for you to potentially select a different insurance plan that will allow you to reduce the costs of your care. I think that this can be a very important tool for people, and oftentimes I think this is a very underexplored option for patients to really think about. There is a wide variety of assistance available to cancer patients, and I've listed here a website that is actually a conglomeration of a large number of nonprofit organizations that provide financial assistance to patients. This assistance extends outside of help with therapies. This could be utility assistance, housing assistance. These are really important that you evaluate all of your options. And oftentimes what I find is that sometimes patients are in one situation when they're first diagnosed, and then their situation changes. And so for programs that have eligibility requirements that are based on your financial income for a year, many women with metastatic disease have variable income and a different kind of circumstance year over year. So checking back to make sure that you could now potentially be eligible for financial assistance is important. You should also know that many new programs are being started every day. In fact, Mary mentioned she's starting a nonprofit, which I think is a great idea. You always want to be checking back to see if there are additional resources that are available to you. Another suggestion that I have is for you to talk with your bank. This can be particularly important if potentially you bank with a credit union. Many banks have set up situations and programs for patients with cancer. They don't advertise them very often, so I will say that that's something that potentially they could do more of. But could you talk to your bank about potentially getting a payment holiday on your mortgage? Is there something else that they could do in terms of granting you a grace period that would allow you to better financially manage your situation? I think oftentimes what we find, and I'm sure in the chat we might get a few questions about this, I think everyone in the beginning is so scared, and rightly so, about managing their cancer care that we don't often have time to make a plan. Talking to your bank, even though you've maybe never talked to your bank before about the fact that you have cancer and that you are interested in trying to figure out how to better manage those costs, is incredibly important. I also want to mention lodging and transportation. So you should know, and again, I'm telling you something you probably already know, transportation to treatment or to doctor's visits is the number one concern of all cancer patients. It is the number one request that the American Cancer Society receives. And in fact, if I worked at another nonprofit, that's probably what they would say as well. There are not nearly enough services out there to provide transportation for patients. The American Cancer Society does have services around lodging and transportation, gas cards, hotel cards, as well as stays for free in 31 of our Hope Lodges. This is not nearly enough, but I do encourage you to call our 800 number and ask what might potentially be available to you. I think that this is really important. I would also say that I've seen a number of women with metastatic breast cancer who are financially able to do it become volunteer drivers for the American Cancer Society's Road to Recovery program, where they are actually driving other cancer patients to treatment. This is quite a generous thing that a lot of folks do, and we're really happy to have their support. But I think what I want you to take away from all of this is that there are a lot of different things that you can explore. Each one of these might feel like, oh, I don't know, I've tried that. I would ask, when's the last time you thought about that? But to also really focus on how you can work on managing some of these costs better so that when you do run across childcare expenses and some of those other costs, that maybe you would have financial resources to afford those. The other thing that I want to discuss with you is something that's important if you are on Medicare. So as a result of a new law that was passed starting in January 1st of 2025, which I know feels like a long time away, out-of-pocket costs for Part D, as in dog, drugs will be capped at $2,000 per year. So Part D drugs are drugs that generally are small pills that you receive either from your oncology practice or you pick up at your local pharmacy. Currently in Medicare, there was no cap for those expenses. And so many patients, including I'm sure many of you on this presentation, have had to experience an unlimited expense. This was something that was unique to Medicare. And in fact, I have heard from a lot of women with metastatic breast cancer who were battling the disease and then became Medicare age and turned their insurance over to Medicare, that they had figured out how to pay for their cancer treatment until they became Medicare eligible. And then they realized that they had this large out-of-pocket cost for their oral therapy. This law is intended to solve this problem for patients. $2,000 is still an awful lot of money, but it is a very positive step in the right direction. And again, this will be available January 1st of 2025. I also want to tell you about another important feature about this law that I hope will help patients. As part of this law, you will have the opportunity to spread your $2,000 cost over the year. This has a weird name. It's called smoothing. Think peanut butter. As many things happen in insurance, I don't think we have a really good marketing consultant that helps us explain what words would make sense to patients. And I don't think that smoothing is a word that people are going to often understand. So essentially what the law says is that Medicare beneficiaries should have the opportunity to take that $2,000 cost and spread it over the year. So if you were someone who knew that they were going to have enroll in this program because you had metastatic disease and you knew that you were going to have all these Part D drug expenses, you could elect to smooth your $2,000 out-of-pocket cost over an entire year. So what this would mean is instead of paying $2,000 in January, which I know many of you on the phone really do not like January when you start your new out-of-pocket cap, right? And you have to start paying all that money, which I think is quite unfair, especially after the holidays in December. But you know that this is a cost you have to incur. So instead of having to pay $2,000 all at one time in the month of January, you would have the opportunity to smooth that cost over the entire year. So roughly that would be about $167 per month, instead of paying $2,000 all at one time. So the details of how this is going to work have yet to be unveiled, and it will depend on what kind of plan you have as to how you will enroll. My action step for you is to really think through about paying attention to anything you're receiving from your insurance company about smoothing. I think one of the things that we really hope is that we'll be able to be successful in this program so that maybe private insurers in other insurance spaces outside of Medicare would offer this opportunity for other beneficiaries. I think we all can agree having to put a large expense on your credit card with not really a lot of assurance about how you're going to pay it off, or when you realize that your interest rate on your credit card is quite high, it's not exactly the way I think we all wanted to manage our cost, and can represent a really, really large challenge for patients when managing their medical care. Okay, so when we talk about that, I think the next thing that I wanted to talk to you about is the importance of public policy change as a really important tool in the fight against cancer. So I have to admit right off the bat, I'm a little biased on this because this is exactly what I do for a living. So I think a lot of times people say to me, well, what do laws have to do with the fight against cancer? Or don't elected officials already understand how important cancer is? I think the short answer is no. I don't think they understand how important their role is in the fight against cancer. And so what I want to do is spend a few moments here talking to you all about some of the things that you could get involved in that are important in the fight against cancer. And so we're going to talk a little bit about the issues, and then we're going to talk about how you can get involved. So one of the most important things, and it builds off Mary's story actually, is making sure that Medicaid is expanded to all eligible individuals. So there are actually 10 states in this country who have decided to not expand Medicaid. These states are primarily in the South, and that's really, really not great, right? So there are a lot of efforts by organizations to make sure that Medicaid is expanded, to make sure that women have access to the safety net service when they live in a particular state. So that's a very important thing. The other thing that a lot of folks are working for is making sure that patient navigators are reimbursed. Again, Mary talked a little bit about the work she's done with the people on her care team. I think that these would be a lot easier for patients if patient navigation was universally provided to patients, regardless of the care setting that they were engaged in. And so we're involved in a very large effort to make sure that patient navigation is reimbursed. And that is something that right now is paid for via charitable care and not reimbursed. So obviously that means it's not in every single hospital. And I think that that is definitely a huge challenge for many patients. The other thing that you can get involved in is resolving the waiting period for women with metastatic disease to receive Social Security disability insurance. So right now there is a really long waiting period, not just for women with metastatic breast cancer, actually for all kinds of disease. And there are a lot of efforts to make sure that this could be something where patients would be eligible more quickly, and make sure that women would have access to Medicare benefits sooner rather than having to wait this mandatory waiting period to receive Medicare insurance. Another important issue, perhaps more important now than it ever has been before, is making sure that if you are prescribed an oral therapy to treat your cancer, that is treated in an equal way to an infused therapy in terms of how much you pay for it. So this is called oral drug parity. This basically means that insurance has to treat oral therapies at the same, in the same way that they treat infused therapies. Right now, in some insurance plans, it is cheaper for a patient to receive an infusion than it is for them to take a pill to battle their cancer. Many of you might say, well, that's crazy because then I have to get a ride to that doctor's appointment in order to make sure that I can get that infusion. I'd rather take a pill at home. That's much more convenient to me. Yes, I agree. And so there are efforts in states. There are a few states, including the state of Michigan, that have yet to pass this law. And we have yet to see this law passed at the federal level. One would have thought coming out of the global pandemic that maybe this is something that Congress would have done, but they chose not to. And so I think we have a lot of work to do there. These are kind of a sprinkling of issues around, how we make sure that cancer patients better access care. But I think that there's a lot in here that potentially you might be interested in because it might come from your personal experience. We also work on a set of issues around accelerating cures. And I think women with metastatic disease are particularly interested in understanding where will that next therapy come from and how can I be part of that? So some of the things that we're working on is some legislation in Washington. There are a lot of acronyms, but it's called the Diverse Trials Act. This is a piece of legislation that will actually allow the sponsors of clinical trials to pay for patients' ancillary costs, so non-medical costs to participate in a clinical trial. So I'm hoping many of you have had the opportunity to participate in a clinical trial. It's a wonderful way advancing science in the fight against cancer. But if you have participated in a clinical trial, you might have realized that some of your biggest barriers to participation are parking at the center where your trial is run, affording childcare or time off work to participate in that trial. If the Diverse Trials Act is passed, this will allow the sponsor of your trial, whether it be a pharmaceutical company or a foundation or a university, to actually reimburse you for those costs. We know that a lot of times patients want to participate in clinical trials, but they are unable to do so due to these extra costs. And so this is something that we're working very actively on in this Congress. I think another thing, and while it seems somewhat boring, it is very important, is to make sure that we increase funding for medical research. So if you're reading the newspapers or listening to TV, you might understand that there is a debate in Congress right now about the nation's debt ceiling and our budget priorities for our country. What I can tell you right now is the discussions they are having will represent a reduction in funding for the National Cancer Institute and the National Institutes of Health. Now, while these organizations are not directly involved in creating drug therapies, they are in fact the institutions that do the basic research that help us understand the human genome and the basic origins of cancer. The way I like to talk about it is research involves a lot of people. It starts with some basic research that is funded by the federal government, and a lot of those hypotheses are advanced by private companies and taken into therapies. This is really, really important work. And I like to tell people that we all pay taxes. Most of us do not like paying taxes. If I got a say in how my taxes would be spent, I would like them to be spent on cancer research. And so this is an important reason for us to advocate. Closely tied to this is a new agency that President Biden has created, which is called the Advanced Research Projects Agency for Health, or again, an acronym, ARPA-H. This is a new agency that's being created to kind of innovatively think about research projects, including cancer. So kind of going outside of the walls of a traditional, study that the National Cancer Institute might do and create different kinds of science. This research is just starting. I think it's quite exciting. This agency is modeled off DARPA, which many of you have heard about. This is a defense agency. You might have heard that before, maybe in a conversation. It is DARPA that actually created navigation systems, right? So they were using it for satellites. That technology was then translated into that fun technology you have on your phone, when you kind of use Google Maps or one of your programs to like figure out how to get like in your car from point A to point B or walking from two places. So that technology started with a government grant many, many years ago. So I think there is a proven track record that these kinds of models can produce some really innovative things. Last but not least, I want to talk about biomarker testing. So we are working on some elements around promoting access to biomarker testing. So I feel pretty confident a lot of women on this call have received biomarker testing to guide your treatment. Not every cancer patient has access to biomarker testing. And in fact, we find that there are a lot of patients that do not. So ACS-CAN is actively engaged in a lot of work at the state level to make sure that patients have access to biomarker testing when clinically appropriate. Biomarker testing not only helps you understand the genetic mutation of your cancer, but it can also help you understand the progression of your cancer. I think this group knows quite well why biomarker testing is quite important. What we need to make sure is that more patients have access to biomarker testing, and that's what this work is intended to do. Okay, so now that we heard a little bit about the issues, why does that matter? How would you get involved? So I think the most important thing I can tell you is I need you to be like Mary. I need you to use your voice and share your story. Oftentimes, I think it is very hard to explain to an elected official what cancer is like, why public policy change is needed. And I think the secret sauce to this is to make sure that we combine data and facts and numbers, kind of like I started this presentation, with a patient's story. And what's best about our system of government here in the United States is that we're a representative democracy, which means at the local level, at the state level, and at the federal level, you have elected officials who are paid to represent your views and your opinions. They can't do that if they don't hear from you. And we want to make sure that we're really sharing these stories. In my dream world, I think about cancer patients as part of their journey, always thinking about sharing their story. Sharing their story like Mary did on this presentation, going into a web form and typing out your story, meeting with an elected official, attending a press conference, writing a letter to the editor. I think we all know that we have important things to share. Sometimes I don't think we know where to share them. So I invite you all to visit my organization's website, which is fightcancer.org. We have a specific page asking folks to share their story. This is really, really easy. I know people think it's not, but I know, having worked with this community for a very long time, that a lot of you are anxious to share your story. These stories are really important. When I think about the story that Mary shared, I think about all the different things she talked about in just a very short time that I would want someone to know, right? Because there are many things I could say about making sure that patients like Mary can stay on Medicaid post-public health emergency, or make sure that she has access to transportation assistance. So telling your story is a very, very important part of what you can potentially do in the fight against cancer, and it really will make a big difference. So with that, Erin, you're back.
I'm back. Hi. Thank you so much, Pam, for such an informative presentation and overview. We are going to transition now to the Q&A section, and we are welcoming Mary back as well. So for those that are joining us, we really would love to hear more from you in terms of any questions or our follow-up clarification that you would love to ask both of our speakers. So you can find the Q&A box on your screen and submit the questions in that way. So I thought maybe we could hear a little bit from Mary, if you could comment about what stood out to you from Pam's presentation. Particularly, I thought that there's some really exciting policy solutions and ideas. Was there anything that stood out to you that you think would have a significant impact, or something that got you excited to hear about those ideas?
Well, I had seen Pam's presentation ahead of time. So I didn't want to step on things I knew she was going to address. And I also knew that my story is so complicated and long that as soon as the camera was on me, I kind of froze a little bit. So I do want to say that if anybody wants to talk with me privately or in a smaller group, I am all for it. It is true that we need to tell our stories. Maybe that's one of the things that stands out to me, especially if we have to admit that we struggle financially. It's a hard thing to talk about. I feel very vulnerable on that particular item. I don't just having NBC. It's just different, right? It's the same thing as being a member of the LGBTQ community. There's a certain level of vulnerability where I'm putting myself out there, and it just feels different. However, this is the segmented group I have been drafted into because of my experience, and I feel obligated to share it, you know. And I see all of this stuff happening with people who can't pay for Ibrance and all this kind of stuff. And one person was saying a couple days ago that she was shocked it was going to cost her $600 a month. Well, I'm hearing people say thousands, right? And so the idea of going on Medicaid or Medicare terrifies me. And the 2025 thing with the cap, it's not soon enough. That's how I feel about it. And I want to get engaged in all of the legislative stuff. And I'm already doing things like Mediviver Stampede and all that stuff. We do have to make our voices heard, right? I think that my personal experience has not been that I qualify for much help. I would like to say that maybe there's something out there I just haven't found. But I get a lot of links to things where as soon as I plug in, it says, like, I'll give you an example. I think, is it the Pink Fund? There was something I saw on LinkedIn today that was talking about their program that will give $3,000, 3 months at $1,000 a pop. Well, that wouldn't meet my needs, right? So for somebody like me, this is not that I need small amounts. The problem exists that is ongoing every month. And that's one of the problems that if we're going to talk about, speeding up SSDI and speeding up Medicare, we need to also look at housing vouchers for people who need that. And I'm going to tell you, and I have all these notes that I never got to in our conversation, but in my county alone, I wanted to find out what's going on with Section 8, which is the housing voucher, right? I knew that there were wait lists, but what I found out is that in my particular county, it says that vouchers are not being accepted at this time. The commission's wait list for vouchers has been closed since June of 2012. And then it says, for those who are on the waiting list, the current projected waiting period for a voucher is approximately 8 to 10 years. Unfortunately, it does not appear that the wait list will be opening for applications in the near future based on recent funding decisions by the federal government. Now, that would have been the thing that hinges on whether or not I could consider, if I needed to right now, SSDI, right? But since that's not available, SSD it's not even something I could look at unless I really, truly could not work. I'd have to be forced into it. So right now, I have to earn as much as I can to try to increase my SSDI amount per month, right? And the problem is not being able to get somebody to hire me. And especially when you look like you're in chemo, right? So there's all kinds of challenges that I've had that I'd be happy to talk with other folks about. And I see the struggle. I see people getting evicted all the time. And that's what that I'm very, very, very concerned about. And SNAP, with what SNAP benefits are, you can't have a nutritious diet for that, and which is especially important if you're sick, right? So that's where I'm coming from. I'm interested in getting more involved in the stuff that you're working on. So I just want you to know that. And, I feel like you touched upon everything that's impacting on my life and the lives of the people that I've been meeting.
Well, and I'm going to say something, Mary. Like, in my office, we spend a lot of time thinking about what kind of story would we want, right? Like, because there are a lot of people that have cancer out there, right? There are 19 million cancer survivors. And sometimes I'm like, okay, like, how do we find those people? How do we tell those stories? Because, for you to say like 2025 is not soon enough, I agree. We should be telling people that.
Mhm.
SNAP doesn't let you have the nutritious foods you need. Yeah.
Mhm.
Because I think sometimes people think there's all this out there.
Yeah, there's not.
Right. And like on paper, yeah, like they can hand you a lot of things, but like how does that relate to you and the very complex journey that you're on?
Right.
And that's what's so challenging. I wish it was like, I don't know, this isn't really a good analogy, but like college aid, where like, you have like you sit with your kid, you fill out these paid, things, there's worksheets and stuff like that. And you're like, okay, like we kind of know what we're doing. Like there are all these different factors. And that's why we have to tell as many stories as possible. I tell people, don't just say, well, so-and-so told her story. So-and-so told her story. Because your story is different than her story because you live someplace different, because you've been with the disease longer, all these different things.
Right. No, also, I'm sorry. I just want to say, like looking at, even in California, where they're looking at Medicaid and a project where they're looking at housing as part of Medicaid, as, housing as part of healthcare. And I absolutely agree with that. I don't think it should be limited to Medicaid, though, right? You can't possibly take good care of yourself if you are housing insecure or homeless. Same thing with not getting nutritious food. There's all kinds of things that we need just to even stay as healthy as possible. It's just not out there. So I'm looking at all the different things that are happening. I believe in Medicare for all. Okay. So I don't even think we should be paying for medication. And that's where I'm coming from. And those are some of the fights that I'm engaged in outside the MBC community, because I think this is a much broader problem that we can't be counting on nonprofits to try to help us pay our rent, or our treatment, or any of transportation, any of that stuff.
Yeah. Yeah, there's a lot of connected and linked issues around this is all connected to quality of life and how to live well with MBC.
Right.
Pam, I was wondering if you could share, Mary mentioned in her introduction around looking like she was going to have to come off of Medicaid, and you referenced in your slide, I think it's been another funny word, the unraveling of Medicaid, as we're seeing the emergency pandemic provisions expiring in May, I believe. So could you share a little bit about what that means for our country, what we're looking at, and how someone that is on Medicaid, what they should be looking out for, both individual looking out for, and then is there any kind of policy conversations that could help expand that?
So you need to circle a date on your calendar. It's May 11th. This is the day where the public health emergency ends. As a result of that, Medicaid agencies across the country are doing verification checks to make sure that the people that are on Medicaid are still eligible to be on Medicaid. Okay, so that's basically what they're being asked to do. During the public health emergency, because of COVID, Congress passed a law that said if you're on Medicaid and we're in the middle of this pandemic, they can't kick you off, right? So we actually, during the pandemic, oddly, had the highest rate of insured Americans that we've ever had in our country. Think about that for a minute. And kind of to Mary's point, like, wow, pandemic, bad. Highly insured Americans, hooray! So now, because the public health emergency is ending, Medicaid agencies are working to each beneficiary to say, Mary, fill this form out, go online, make a phone call. Mm-hmm. One of the things that's challenging is Medicaid beneficiaries move around a lot, right? Housing stability in the Medicaid population can be challenging. You might be sharing, an apartment with someone and then move to something else and whatever. And oftentimes the address that the Medicaid office has for you is not actually where you live. So if they're sending you a very important letter that says you need to fill out this form so you can retain your Medicaid, and they can't find you, they're going to kick you off Medicaid. So the number one thing folks should do is, if Medicaid is your insurance right now, and let me say something carefully, you should make sure that what kind of plan you're on, because in many states, Medicaid is not called Medicaid. In Wisconsin, it's called Badger Care. That's really great. Except then when I talk about Medicaid, people on Badger Care are like, that's not me. It is you. So first of all, understanding what kind of insurance you have. Are you really on Medicaid or not? And then if you are on Medicaid, making sure that your address is up to date with that agency. You can use your smartphone and Google, right? Your Medicaid agency. There'll be opportunities there for you to update your information. If you are eligible for Medicaid, that you should be able to stay on Medicaid. There's nothing that has changed the requirements of who is eligible for Medicaid in these states. It's just that they need to go through and re-verify this. This will mean millions of Americans will lose their insurance, which is obviously not a great thing. But I really encourage people to, first of all, like I said, I've worked with patients before that don't know they're on Medicaid because their state name is a different name, and they just, why would you know? But making sure that you have the right address on file and the right information with Medicaid so that they can send you the enrollment form. There's nothing wrong with calling your insurance company and saying, like, wait, will I still have insurance on May 12th? And they will say, like, oh, well, I mean, if you pay your premium, sure. And then you're like, okay, then I'm fine. But this is something that's really important, because I do think there's going to be a big challenge here. And it does not help that a lot of people on this program don't know that they're on the program.
Yeah. Thank you.
I know, at least in Maryland, which is where I live, they're already doing the thing where they're reaching out to people to say, update your information and so forth. I had to renew my Medicaid back in November, so I already had to give them information about 2022 before it wasn't even over yet. And so I had to make an estimate as to how much I thought I would be earning in the final months, which I didn't end up earning as much. Either way, what I earned was nothing. I mean, really, it's such a small amount of money. The idea that I don't qualify for Medicaid anymore is mind-boggling to me. Right.
Mm-hmm.
But with the pandemic, they didn't count pandemic unemployment insurance as income. And that's why I was able to qualify for it at that time. But in 2022, which I'm actually embarrassed to say as a consultant, I only earned 21 grand, and I earned too much for Medicaid, and I owe $4,500 in self-employment tax that I can't afford to pay on that amount of money. So, even how they count it, if you're a self-employed person or a gig worker is different, it's a challenge. So I'm going to end up losing it. And I'm thinking that when I move, I might end up triggering this sooner, because I have to move at the end of May, than if I waited for them to decide it's my turn for them to take a look at me. Right. So.
Well, we are getting close to the hour. One thing I just want to share, I appreciate, Mary, your comments in the beginning of talking about the time toxicity that you experience, the amount of energy and time it takes to navigate what little safety net programs are available is enormous. So I appreciated you sharing, and I wrote down that word. It was a phrase. I think it's a really important message to get across, that it's a lot of time and energy spent on this.
And it's not just chasing after the things we need financially. It's even all the stuff we have to do just to coordinate our own care. And I find that it's taking me 3 to 5 touches and emails, phone calls for simple things like scheduling my scans. Yeah. And every minute I spend doing this takes me away from the things I need to do to try to earn money and to try to, live a healthy and safe life. Yeah. And with that, I rest my case.
Yes. Pam, I want to just see if you have any closing remarks that you would like to share with our audience on this topic.
I mean, I think for me, Mary said something that struck me. I think you are your best advocate, right? You already know that. Living with metastatic disease is daunting, I think would be a polite way of saying it. I think expanding that advocacy a little bit further to make sure that elected officials know, because like I said, this could just be an email. It could just be a phone call. And while to you that might not seem that important, you oftentimes find elected officials saying, this is something I met with a constituent, or I heard from a constituent and she has this situation. And so I'm proposing X. Mm-hmm. Why not have that be about cancer? Why not have that be about benefiting our community? Mm-hmm. And so just realize that your voice and your story is incredibly important and can make a real difference.